All right, welcome back to the answer for our Tuesday trivia. I was supposed to report yesterday and I didn't, so sorry about that. But our scenario was about a postmenopausal woman who had itching and burning. She had vulvar pruritus and burning on her vulva and had been treated twice without successful resolution of her itching. On exam, she had pale, white, thin tissue with many excoriations. What was her diagnosis? The answer here is lichen sclerosus. And let's talk about that. Oftentimes when we see persistent vaginal irritation that goes on and on despite treatment for yeast, it's not actually yeast. Often people will give someone a diflucan or treat you for yeast because it's normally the easy option, but that's not always what's going on. So just ask for an exam, make sure someone looks at you because it may not be yeast. And you can get as much diflucan as you want, it's not going to get better. Lichen sclerosus is a chronic inflammatory condition of the vulva. It happens when you have persistent pruritus. The tissue can get really thin. It can become frail and have breaking and burning. Sometimes it can be itchy. Other times it can just be raw and painful. If you have all of these symptoms, and especially if you see some white patches, you need to be evaluated. If you don't treat this appropriately right away, you can have scarring and thinning of the labia minora and even of the clitoral hood. Also, this can be a precancerous lesion towards vulvar cancer. So it's rare to progress to that, but if this goes untreated for a long time because of the chronic inflammation and cell changes and cell inflammation, we know that this can lead towards vulvar cancer. Most of the time we can diagnose this right away with just an exam. If it's not responding to treatment as we expect, or there's any other concern, we can do a small biopsy where we numb the tissue and take a small sample of the skin in order to send it off and confirm what's going on. The best treatment for this, because it's chronic inflammation, is to treat it with steroids. It's a topical steroid that we use, typically a high potency steroid, because this is bad and it needs to be treated aggressively. Most of the time, this is a long treatment course, because if you get steroids and you take them for a couple of days and then the itching goes away and you stop, it will come back. It's chronic inflammation. So we have to treat it so aggressively that it tapers off. Typically, I'll do about 4 to 6 weeks of twice daily steroids, followed by once daily steroids for another 6 weeks, and then we can alternate. And in these patients, often we'll have to continue treatment, sometimes even lifelong, once or twice a week just to prevent it from coming back. Again, this is all to prevent long-term scarring, pain, and even progression to potential cancer. So if you think you might have lichen sclerosus, or you have a patient that has persistent itching despite treatment for yeast, please have them see their gynecologist. We're here to help.